Knock, knock, knock. Hi, I'm Jessica. I'm the student nurse. I'm going to be doing a health assessment on you. Is that okay?
Yes.
Okay, well, I'm not supposed to ask if that is okay, but I'm going to be doing a health assessment on you. Can I see your wristband? Can you please tell me your name and date of birth?
Aaron Rollins, 4/16/81.
Okay, thank you, Aaron. Well, I'm going to go wash my hands again, and I'm going to gather supplies, and I'll be right back. Okay? Just wash my hands. While I was gone, I was able to do a neurological test on Aaron and the Glasgow coma test, and he got 4 points for being alert and spontaneous when I walked in and looking at me, and he got 5 points for the vocalization when I asked him his name and date of birth, and then he got 6 points for the motor response of showing me his wrist. So he's 15 on the coma scale, which is completely normal for a awake human being that's not in a coma. All right, so I'm back. Hi, Aaron. So I washed my hands. So I'm just going to ask you a couple questions, and then you just tell me your responses, okay?
Okay.
So the first thing is, can you tell me where you're at?
I'm at the hospital.
Okay, and why are you here?
I've had abdominal pain.
Abdominal pain? Okay. On a scale of 0 to 10, what would that be? 0 being no pain, 10 being severe pain.
Like a 3.
A 3? Okay. And then is there situations where it comes and goes, or something makes it better or worse?
If I eat too much food.
Too much food, it hurts? Specific types of food or just any food?
Kind of any food.
Okay, awesome. Well, when the doctor gets in here, we'll be able to assess that further, and hopefully we can get you taken care of with that pain. Okay, so Aaron was able to be aware of his surroundings, so he is normal in that he knew where he was at, and I'm going to test his knowledge, his common knowledge. So can you please tell me where do rocks float on water?
No.
No? Okay. And do birds fly?
Yes.
Okay, and then are there fish in the sea?
Yes.
Okay, great. Awesome. So his common knowledge is normal. He was able to accurately identify common knowledge things. Okay, and I'm gonna test his memory. And by the way, I wouldn't be telling him, I would be testing him, but I'm verbalizing my assessment, so that's why I'm saying it out loud. So Aaron, can you please tell me when is your birthday?
4/16/81.
Okay, I know you already answered that. And how many months are there in a year?
12.
Okay, and when's your wife's birthday?
February 12th.
Okay, you failed. Just kidding. Okay, his memory is accurate. And Aaron, so a serious question, which I wouldn't say that, but do you have any thoughts of hurting yourself or others?
No.
Okay, so Aaron's normal on the memory and the scale of not hurting himself or others. He's normal on that. Okay, so I'm just going to test your cranial nerves now, just to see how they're doing. So I'm just going to shine this light over here, and I want you to keep your head straight, and then just don't look at the light, and just keep your head straight for me. Okay, and then follow the light up, follow the light down, follow the light to the side, to the other side, okay, and then follow the light in. Great. Okay, and then can you smile for me? Good, and then stick out your tongue. Awesome. Okay, so I just tested your cranial nerve with your eyes and your pupil dilation and your accommodation. Your cranial nerves 3, 4, 6, and 7 are normal. Your pupils constricted and your eyes accommodated, and you're able to follow the light, so good. And then 7 and 12 with your smile and your tongue sticking out are normal and working properly. During that same time, I was able to assess his perla. So his perla, his pupils are even with his iris. He was perla, P-E, his eyes, God, what am I saying? His pupils dilated or restricted, and I am having a brain fart. And then they were able to accommodate to the light. So good. So the light, restriction, good. Okay, so you passed on all that, so that's nice of your neuro. And the next assessment I'm going to have you do is I'm going to test the bottom of your foot. Let me grab my pen. And I have this little sponge, and I'm gonna put it on your skin with your eyes closed, and you tell me if it feels dull or if it feels sharp. Okay? So can you close your eyes?
Feels normal.
Well, is it dull or sharp?
Dull.
Okay,
Sharper.
so it's sharp.
Sharp.
Okay.
Dull. Sharp.
Okay, good. So your sensory is normal with the dull and sharp pain. Good. And then can I have the bottom of your foot, please? I don't know. Okay, good. Look at this.
Ah.
Oh, okay. So, he reacted normally for the Brunsky test. I believe that's the Brunsky test, where you touch the bottom of the foot. He did not flare his toes. He curled them in from the sensory test. So, good. I'm sorry, thinking that would be it. Oh no, actually I need you to get up please, and can you please walk 5 feet and turn around and then just walk back. Okay, Aaron's gait looks normal. He's not having any swaying when moving. It's effortless. So you pass that, good. Your neurological on that is normal. Can I please have you close your eyes and then just stand there please with your feet together. Okay, and I counted to 20, and Aaron is not swaying, it's effortless, he's not having anything wrong with that, so good. Go ahead and open your eyes. I think that we are all done with everything. You did really well with the neurological exam. All of everything came out normal, so we got to assess that. The next thing we're going to assess is your muscular skeleton. So if I can just have you sit down, please. So the muscular skeleton, I just want to explain the procedure real quickly. So basically we're going to be testing your joints. So do you have any history of family joint disease? Do you have arthritis?
No.
Are you worried about anything with your joints? Are you having pain with movement,
No,
swelling,
really.
Tenderness? Are you hearing any type of cracking?
No.
No? Okay. So that's good to know. So we're going to be assessing on I'm going to be assessing and looking at to see your muscle size, to see if there's shape and even, and looking for lumps, your skin color, checking for heat, and pain. So yeah, and then masses and lumps. I don't know if I said that. So masses, lump, and then also your strength. I'm going to be checking your strength to see if you're able to do some resistance strength exercises. And then that scale is a 0, meaning like you have no movement, or a 5, which would mean you're able to give resistance back when I present it to you. All right?
Okay.
So you ready to get going?
Yeah.
Okay, great. So the first thing I'm going to do is I'm going to do your upper body strength test. So if I could just have you put your hands out like this. Okay, can you push with your wrist on my hands like that? Okay, great. And then pull back. Okay, great. And then also I'm going to do a grip. So can you pull your hands? Okay, good. That's normal. You got a 5 on the pushing and the pulling and the grip. Awesome. And then I'm going to have you put your arms out like this. Okay, push your arms down. Okay, push your arms up. Good. And then go like this for me, sir. Okay, and then push your arms up. Okay, and then push your arms down. Good. Your resistance is a 5. You're able to give me resistance back, so that's really good. And now I'm going to check your legs. So I'm going to put your legs down, and then can you push your legs out? Push your leg out. Good. And then pull leg back. Great. And then can you push your foot up? Push my hand. Push my hand. Good. Okay. Push resistance. Good. Push resistance. Good. Push my hand. Great. Push my hand. Awesome. Your resistance is nice and even. It's good. You're 5 on the lower half extremities on your resistance. So I'm going to have you stand up, please, and turn around. I'm going to be checking your spine. So if I can just have you lift up your shirt. I'm checking, I'm palpating your spine. It is even. I don't feel any masses or abnormalities. Can you lean forward? I see a normal curvature. I don't see any signs of scoliosis. There's no signs of, you can stand up now. The thoracic cage is not overexerted for signs of kyphosis. Okay, and there's no abnormal curvature extremity of the lumbar, which means lordosis is not present, so your spine and everything is good. You can turn around for me, sir. And now we're gonna just test for range of motion. So I'm gonna test first for your hip area. So can you just twist? Okay, great. And then can you go sideways? Oh, you have to do the arms, just, yeah. Okay, great. And then for your lumbar, and then forward. Really good. Does that hurt, or you hear any pain or feeling any pressure or pain when you're doing that? Great. Okay, so you have normal range of motion. That's good. And now we're gonna move up to your cervical area. So can you just follow my movements? Make sure I'm in this. Okay, forward, back, and then looking side to side. Okay, good. Awesome. And then we're gonna move down to your shoulders. I'm gonna take this off real quickly. And we're gonna put your arms straight forward. Here, I can move this chair out of the way. You can have a step back, please. So arms forward, down, back, go back, and then we're gonna go all the way up to the side, all the way up. Can you go all the way up? Down, okay, all the way down. Okay, I'm gonna lift your shoulders up, down. Can you roll your shoulders back, roll your shoulders forward. Are you having any pain or anything popping or crippeting or no? Okay.
No.
Okay, awesome. So now we're gonna move down to your arms. We already did your arms, so now we're gonna move down to your elbows. I don't know if I did the resistance on your elbows. So I'm gonna do resistance real quickly. Can you push arms up and then push arms down? I don't know if I did the resistance on that. So we're gonna go up and then down and then like this again. Can you do pronation with your whole arm? The whole arm from the elbows. Okay. And then out. Okay, great. And then you can go down. And now we're gonna move on to the hands. Can you push your hands back, forward, side to side? Okay, and then just in a circle. Awesome. Does that feel okay?
Mm-hmm.
Okay, great. And then I'm gonna have you extend your hands out in, and then can you grip? Good. And then with just your hands, can you go like supination, pronation? Okay, and I'm just gonna feel your hands. You can put your hands down. I'm just gonna feel your hands. Tell me, checking, palpating for any joint pain.
It feels good.
All right, and I don't see any clubbing of the fingers. He has a capillary refill at under 2 seconds, so that's normal. There's no signs of edema. There's no swelling. Capillary refill under 2 seconds. No signs of edema or swelling. He looks like he's well hydrated. Okay, go ahead. And so we have your shoulders done, your elbows, and your hands done. So now we're gonna move, and we already did your spine and your thoracic and your lumbar. So now we're gonna move on to your hips. So I don't know if you're gonna need to hold on to anything, but can I just have you put your leg out like this? Okay, in, and then try to go in. No, just one leg at the time, please. Okay, in, or you can go like this with your leg. Out. Okay, leg forward, leg back. Okay, you put it down. Okay, and then other leg forward, back, leg to the out to the side, leg in, leg up like this to the side, in, all the way over. Okay, good. How does that feel? Any pain?
No.
Okay, great. Now we're just gonna go onto your knees. We can actually have a seat though. Please have a seat. So I haven't heard any signs of crepitus, which is good. That would be the crinkling of bone or of your joints, and that would be, you would hear it and it'd be painful. So your knees are also an area that I want to palpate just to make sure that there's no swelling. Are you having any pain with your knees?
Tickles.
Are you having any pain with your knees?
No.
No? Okay. All right, sir. So I'm gonna just have you extend your foot, your leg out. Okay, bring them back. Okay, great. And then your ankle, can you put your ankle straight, flex it, and then pull it back, and then do supine, which would be like inwards, and then outwards. Great. And then we do the planters. All right, and then your toes, can we just bend them and then straighten them, or extension? Okay, great. Well, everything looks good on your musculoskeletal assessment. You're not having any pain. There's no sign of crepitus. So crepitus. I don't know why I keep saying crepitus. Crepitus. So I think we're good on that. So now we're going to move on to the final abdomen assessment. So I just want to ask you a couple questions real quickly. How are you having any problems with your abdomen? Are you worried about? Are you having normal urine?
Yes.
Okay, and when was last bowel movement?
Yesterday.
Yesterday?
At night.
Okay, so, but that's okay. So you can miss a day, so that's normal unless you're having issues with that. And is your poop, your bowel movement, is it normal? Are you worried about the color or consistency of your feces?
No.
No? Okay, great. Well then, I'm just gonna have you stand up real quickly, please. And I'm just gonna lift up your shirt. And I'm just visually looking for any sign of hernia. His stomach is flat. I don't see any protrusions or signs of abnormalities from just looking at it. And I don't want to palpate yet because I have to auscultate first. So sir, can I have you lay down? Lucy, okay, get down. All right, sir. So I'm going to listen on the diaphragm side to the lower right quadrant, and then I'm going to listen for bowel sounds, and I have to wait to hear that sound. And then the upper right, the left upper right, or the left upper quadrant, the lower left quadrant. Okay. So lower right quadrant is where I'm starting. Oh, there's some digestion going on there. Good. Great. Okay, I hear you're able to listen with the diaphragm very well to your bowel sounds. Everything sounds like a normal movement. There's no hypo tension sounds or hyper. It sounds just like normal bowel movement sounds. And now, sir, I'm gonna listen to your aorta and then your renal arteries and your iliac arteries and your femoral arteries. And I'm using the bell side for that. So, and the aorta is right underneath the sternum. And I'm checking for any bruit, would be sounds of swishing. Okay, I don't hear anything. So now I'm going to switch over to the left renal arterial. Don't hear anything. There's no sign of bruit, and then I'm going to iliac. And then his femoral. There's no signs of abnormalities or bruit, so that's good. Okay, sir, and then the next part, we're almost done. I'm just gonna softly palpate your abdomen. Does that feel painful or anything?
No.
Is there any pain or rigidness when I touch? No? Okay, I'm gonna palpate a little harder. Checking for any masses or lumps. Everything feels good. Awesome. Well, Aaron, I just did your assessment and everything looks normal. Your doctor will come in and can talk to you about the abdominal pain that you might be having. And thank you for being my patient.
Thank you.